During World War II, the U.S. military created a bomb that used bats. The plan was to attach tiny incendiary devices to bats and drop them over Japanese cities, where they would roost in buildings before exploding. In 19th century England, resurrection men would dig up fresh corpses to sell to medical schools. The demand for cadavers was so high that some, like Burke and Hare, skipped the digging part and simply murdered people to sell their bodies. Sigmund Freud, the famous psychologist, regularly used cocaine and prescribed it to his patients. He believed it cured depression and indigestion, and wrote several scientific papers praising its benefits before eventually recognizing its dangers. During World War II, the Japanese military set up comfort stations, where an estimated 200,000 women were forced into prostitution to service soldiers. Many were kidnapped from Korea, China, and the Philippines, with some as young as 14 years old. In the early 19th century, companies began marketing opiates, such as morphine and laudanum. Morphine was first isolated in 1804 by German pharmacist Friedrich Serturner, and was commercially produced by the pharmacy that became Merck in 1827. Laudanum, a tincture of opium, was introduced earlier by the Swiss alchemist Paracelsus in the 16th century and was widely used for pain relief. By the mid-19th century, these substances were commonly used in medical practice. The introduction of the hypodermic syringe in the 1850s further increased the use of morphine.